and that the hospital can care for the appropriate higher acuity sicker patients. So that's our goal with this space, and we're just so grateful to Sam, wherever she is, and the team from MEMA for helping us to get the resources that we need to really feel confident that we can take great care of patients here. We've got oxygen concentrators. We can deliver up to 4 liters of oxygen at the bedside. We've got our IV pumps, not in this particular bay, but the electric beds and just the distributed lighting plan, all these little subtle things that in the spring we didn't know enough to ask for, and this time around we knew enough to ask for them, and we had them delivered. So
the HVAC, we did look at the Songas as a possible alternative. This, the gym here and the way the HVAC system is set up is, you couldn't probably ask for a better, because it just separates from the walls here. We're on a separate unit here. So we just installed the HEPA filters, and when we're up and we're running, we're in a hospital grade air exchange here. So again, couldn't ask for probably a better environment.
That would be much harder to do in the sun.
Absolutely. It was just, that was really sort of the limiting criteria right out of the gate, that said we couldn't do it without major infrastructure investments. Leaked off, they'll put it into the trash container. They'll then exit over to the side where they'll take off their protective eye gear, and we'll keep that. They can reclean it and reuse it. They'll take off their N95, don a surgical mask, and then they walk through a door that puts them into the pool space, where they then can go in, and I'll show you on the other side. Now I can take a break, have lunch, lounge, relax, check notes. We don't have the ability for showers here for staff. We do have for the patients. Being a gym, it's conducive to that. So we have private lockers for all the patients, showers, and obviously toileting. So then staff will come in here, and this is where they'll come out of the doffing station as well. And we'll have this set up. We're bringing in relaxing chairs so they can just chill, get online. We'll do the food service for the staff here. They'll don their PPE in here. There's stations over here where the nurses can go online and do patient charting or information. And then we also have in the back sort of a command center, and we're actually set up a few beds for some of the providers if they need to have a quiet place to get a few hours sleep. Set up to get their own private racquetball court. So, I mean, but honestly, from a facility standpoint, I really believe it was almost meant to be, in a sense. If we had to do this again, I would go and say, Jackie, can we come back? It works. Yeah. You know, I think it's the right size, square footage, the HVAC, the electrical component, and we have a blueprint now. So for me, at least, this was a lot less stress.
Secretary and I didn't want to do it more than once either, but the resilience of this community on this issue has been really special and makes a huge difference. Again, I want to thank you, Jackie, for letting us borrow this for a while.
It's our honor.
We'll be out of here by June, I promise.
I'll let you tell the story. They're really pleased to see the university be of service in this way. And who knows, we may have the biggest classes coming in ever after all these patients get good care here. So they'll think about UMass Lowell. So